Hi, I'm Steve Grcevich, and I'm the president and founder of Key Ministry. And in our video presentation today, this is where the rubber really hits the road. So we've already introduced you to the 7 barriers to church involvement for children and families impacted by mental illness, and we've introduced you to 7 broad strategies for overcoming those barriers. So now we're going to get down to specifics and talk specifically today about how you can overcome the barriers to church involvement related to mental health stigma. And so what we're going to talk about is how you develop a communication strategy in your church in order to do this, talk about the role of education and support groups in overcoming stigma. We'll talk a little bit about just how you serve people and the types of practical helps that you offer and the way that you market and promote those helps in your church. Helps to reduce stigma. We'll talk a little bit about specifically how you can engage people in your congregation to help. And then finally touch a little bit on the membership of your team and how you might want to pull in people from outside your church in a larger community to help to change perceptions about mental health when it comes to church. So with that said, probably the single most important strategy that we talked about before when it comes to overcoming stigma related to mental illness is your communication plan. And in particular, what gets said from the pulpit on Sunday morning is absolutely essential. In one of our earlier segments, I referenced the research from Lifeway that showed that the majority of families impacted by mental illness want to hear their pastors talk about this from the pulpit, but that the majority of pastors don't ever talk about mental health related subjects. So that one of the easiest ways of communicating to folks that this is a safe topic to address is to incorporate it into your sermons or incorporate it into your teaching on Sundays. Some churches might consider having a specific Sunday that's designated as a mental health Sunday where you have a member of your staff that's been impacted by mental illness preach or teach on the subject. Or perhaps like a colleague or an associate from another church come to speak on the subject. Since, according to the Lifeway study, 23% of pastors have had a personal experience with mental illness, it shouldn't be too hard to find somebody who can help to be able to teach on that subject. It's even something that I've been invited to do in the context of the work that I do with Key Ministry. So if you're interested in learning more about that, go ahead and check out our website. Speaking of which, one of the things that's important in terms of thinking about mental health inclusion is if your team's going to all the trouble to put together a plan, is there any way that folks would know that in your community from looking at your website and from looking at your church's social media? Another important, decidedly low-tech piece nowadays, given these cool toys that we all have available to us, is your church bulletin. So, if your church is, providing certain services, supports, certain educational programs, groups, would people know about it if, for example, a member of your church happened to share the church bulletin with somebody that they knew, a friend or a family that was struggling with these topics? So think about how you incorporate this in your high-tech communication, but also in your low-tech communication. And then finally, more and more churches are using social media as a tool to communicate. And one of the ways of changing the perceptions in the community, and we had talked before about the study that showed that the majority of folks who don't regularly attend church perceive the church as unwelcoming to persons with mental illness. One of the easiest ways in your community to dispel that piece of stigma is to post mental health related articles of interest, information through your Facebook feed, through your Twitter feed, which becomes easy for folks within your church to be able to share with friends and share with others in the community and change the perceptions about the church when it comes to mental illness. Now, the second way of basically hanging out, like laying out a welcome mat, would be to think about what your church is offering in terms of mental health education and support. One of the places where you oftentimes have to start with first in this arena is your own church leadership. And the folks at Mental Health Grace Alliance offer an excellent course specifically for church staff members, church leaders, church board members called Mental Health 101. I would encourage folks who are interested in learning more, maybe as a foundation even to your entire mental health inclusion planning process, to consider taking advantage of that resource. We talked earlier that 2 Christian-based models for mental health support are the Grace groups that are run by Mental Health Grace Alliance and Fresh Hope, offered by their ministry out in Nebraska. One of our most popular blog posts ever at Key Ministry was our blog post called We Have No Casseroles, where we talked about the fact that when families are going through a physical health crisis, oftentimes your church's meal ministry is there to extend support. It doesn't oftentimes happen when folks are going through a mental health crisis. So that one of the things you may want to do as part of your inclusion plan is to very explicitly let folks know that if a family's having a mental health emergency, if it's a situation where there's a child or a teen where the parents are having to transport them for treatment several days a week, that they may, you may very much want to consider or to make people know that they can make use of your meal ministry too. If someone ends up on a psychiatric floor in a hospital, are they going to be visited by a pastor from your church or a member of your care team? One way of dispelling stigma is to make it very clear, in your printed materials and in your website to your members and to your attendees, that they're certainly welcome and encouraged to contact the church for those types of supports when someone's experiencing a mental health crisis. One of the best ways, and we talked earlier in terms of communication about what your church is putting out through your social media channels. This is an easy place for your congregation to be able to help in terms of changing perceptions in the community. Because one of the issues, like when you get into Facebook, when you get into Twitter, the more people that are sharing something, the more likely it is to appear in folks' newsfeed. And so one way that you can elicit the support of your congregation in changing the perceptions about mental health in the community is by giving them specific mental health resources to be able to share with their friends, with their neighbors. It's a way of communicating that your church is likely to be welcoming to them. And it's a way to create significant engagement on the part of your people, and it's a way of minimizing the cost of being able to communicate, to the folks in the city that you serve, that again, your church is prepared to be able to welcome folks who have some of these struggles. And then finally, one last thing that you might want to think about in terms of the makeup of your inclusion team. Given that one of the things that you're doing is that you're looking at changing the perceptions about mental illness, not just inside your church, but outside of the church, and changing this perception that we're not particularly welcoming, is that you might want to specifically invite the executive director of your community's mental health board, a key staff member with the mental health board, perhaps the executive director of any mental health support organizations in the community, to be part of your inclusion team, because their participation on the team is likely to lead them to go back and talk to others in the mental health community about the fact that your church is assertively doing something to change perceptions in terms of stigma. And so, they may have access to and have influence with folks right now who are outside of the church. And part of the reason why we're doing this is to make disciples. And in order to do that, we're going to have to build relationships and develop connections with folks who maybe aren't plugged into church right now. And so think about people outside of your church, within the mental health system, who might be able to lend their expertise and their knowledge, to your inclusion plan, but also folks who are going to go out and talk about the fact that you're looking to do something differently compared to other churches. If you're interested in learning more, feel free to go to our website at www.keyministry.org. And in our next segment in this series, in terms of overcoming the 7 barriers, we'll talk specifically about how we apply some of our ministry strategies to overcoming challenges related to anxiety in church. Thank you.